So this is day one. I've said this like 14,000 times. This is the last time. Really quick keynote points. I'm not sending this to be edited because my editing person takes too long and I was supposed to start this 2 weeks ago. So you get this version. Point number 2, these videos are entertainment purposes only. I have to say that because it's not for diagnostic reasons. It's for learning and entertainment. Don't take it and run with it and give yourself a diagnosis. Always refer to your doctor if you hear something or if you have symptoms of something that you would like more answers to. We are just going to go through our series. It's a 13-day series of 26 mental disorders and illnesses. Some of them were written in by other people that are diagnosed or know someone diagnosed and wanted them covered. We're just going to give you the diagnostic criteria from the DSM-5, which is just the latest psychiatric diagnostic manual from, the world. That's how that works. And then talk about some myths associated with the disorder and some ways to treat or manage it. So, this is Lindsay also.
Hi.
This is our final take on this.
Yeah.
I swear to Lanta. So, our first one up is attention deficit hyperactivity disorder, which is very ironic given the post the other day from that girl. I have been very open in the past. 2 years ago, there was a series about like my life and living and managing and all this other stuff. So if there is anyone left from 2 years ago, hi, I'm back. Took a break for a very long time. 2 years long. But this is not about me or my personal experience. This is just informational. So there is tons of misinformation due pretty much only to acronym misuse. So a lot of people will take an acronym from not only ADHD, but like OCD as well. And then they're like, oh, my ADHD is so crazy today because I saw a squirrel and then I couldn't finish my work. It's not what it is. So stop doing that, please. It doesn't personally offend me, but it'd be the same as if I were to lay in bed all day and be like, wow, I'm such a cancer patient. It's the same thing. Just because you can't see a disorder doesn't mean that it's not real. Stop diminishing it through your wanting to be quirky or thinking that it fits the narrative of how your day went. It is classified as a neurodevelopmental disorder, meaning you're born with it, it's in your brain. You don't just fall on your head and all of a sudden have ADHD. So don't think there's something wrong with you. Innately, there's nothing wrong with you, unless, you're a very horrible person and you're a murderer or something crazy. But just in this in itself, there's nothing wrong with you. The diagnostic criteria in the DSM-5 is pretty lengthy, so we're going to break that down. But all it is a persistent pattern of inattention we're going to get into the and/or, hyperactivity, impulsivity, that interferes with pretty much your daily life. So your functioning or your development, and it's characterized by 2 subtypes. Number 1 is inattention. So for inattentive ADHD to be diagnosed, 6 or more of the following symptoms have to be present for 6 months or more, and to a degree that is not compatible with a developmental level. So the DSM is usually blamed for taking everyday personality traits and like turning it into a disorder, but that's not what it is. It's in excess, and it's something that negatively impacts your social, occupational, or academic lifestyle. So some of the inattention symptoms are often fails to give close attention to details or makes careless mistakes. Don't know anyone like that. Often has difficulty sustaining attention in tasks or play activities. Often does not seem to listen when spoken to directly. Often does not follow through on instructions and fails to finish tasks. Often has difficulty organizing tasks and activities. Often avoids, dislikes, or is reluctant to engage in tasks, that require sustained mental energy or effort, often loses things necessary for tasks or activities, is often easily distracted by extraneous stimuli. So for a child, this would be like something outside of the classroom or whatever. For someone who's older, who's learned to mask or manage, it's going to be, unrelated thoughts to the conversation that's happening. Flip. We have notes, because I wasn't remembering all of this. And then lastly is often forgetful in daily activities. I will cover this in a minute, but females typically tend to present with more inattentive symptoms than boys who are going to present with more hyperactive and impulsivity symptoms. That's just brain differences. So subcategory 2 is hyperactivity and impulsivity, and Lindsay's going to do it.
Often fidgets or taps hands or feet or squirms in seat. Often leaves seat in situations where remaining seated is expected. Often runs about or climbs in situations where it is inappropriate.
Pause. So the running around or climbing in situations that's not appropriate is obviously going to change as somebody gets older, because a 17-year-old person knows, let's not climb on grandma's casket or pretend we're superheroes in the middle of church, right? Most 17-year-olds. But, you know, someone who is younger than 17, which is just the age that they base their diagnostic criteria on, is not necessarily going to have that shut off. So someone over 17, yeah, you're not going to be out like climbing buildings and trees because you want to, but you're going to have feelings of restlessness. Sorry, go ahead.
Often unable to play or engage in leisure activities quietly. Is often on the go as if driven by a motor. Often talks excessively. Often blurts out an answer before the question has been completed. Often has difficulty waiting on his or her turn. Often interrupts or intrudes on others.
So those are hyperactivity, impulsivity symptoms. And there's a third subcategory that's both. So you can be both primarily inattentive, predominantly hyperactive or impulsive, or you can be a combination of both. There's really no like set, this is the way that someone is going to be. It's just a combination of all the symptoms together. Several symptoms need to be present before the age of 12 for ADHD to be the diagnosis. Otherwise, it's going to be classified and looked at as a different disorder. Several symptoms, again, have to be present in 2 or more settings. So it can't just be someone acting out at school. That might be oppositional defiance disorder instead of ADHD. And there has to be clear evidence that the symptoms interfere with or reduce the quality of life, whether it be in a social, academic, or occupational setting. And the symptoms don't occur exclusively during the course of a schizophrenic episode or another psychotic disorder, and they're not better explained by another mental disorder, because a lot of these traits and a lot of these symptoms can be explained with a different disorder. It's just a matter of when they occurred, when they started happening, or why they started happening. And flip. Again, there's combined presentation or predominantly impulsive, hyperactive, predominantly inattentive. Again, I already touched on it, but females typically present with inattentiveness versus males who are going to present with more hyperactive, impulsive symptoms. You can be both, though. It's not one or the other, it's just what you are predominantly. Boom. I'm trying to think of big words, and I can't do it right now because we've done this so many times today. The diagnosis usually happens in early childhood, and then because it is a neurodevelopmental disorder, it doesn't go away. You'll be reassessed throughout your entire life, most of your life, if you choose to go. But reassessment does happen, and later on in life, which is why the statistics are so flawed, you could be diagnosed with something else, such as oppositional defiance disorder. That's why 5% of children are affected with ADHD, and only 2.5% of adults are reported, because it doesn't go away, it's just a different diagnosis is given based on evaluation throughout the years. Boom. People with ADHD do display increased slow wave electroencephalogram. That's a big word. Reduced total brain volume on MRIs, small brains, and a delay in posterior to anterior cortical maturation. These are not used to diagnose, though. You can't just give someone an MRI and be like, wow, your total brain volume is down. You have ADHD. Those are just signs that are caught in physicalities that are looked at after someone has been diagnosed. Now let's cover some myths. Mythbusters! You remember that show?
Yeah.
Okay, anyway.
So the first myth is ADHD is a childhood disorder only.
Boom, we just talked about that. 2.5% of adults are diagnosed with ADHD. The symptoms present or change into adulthood. So as you grow, you start to learn, maybe I shouldn't do these things in public or in school or et cetera, or you've been medicated at that point in time. Either way, the symptoms change, and not that they go away, but they tend to, you mask them. So it's all about learning how to be a part of society.
Another myth is eating sugar or watching TV causes ADHD.
I feel like that was more popular back in the day. You're born with ADHD. It's not, you can't just drink coffee one day and have it. That's not how it works. Glucose-based foods or inactivity, such as watching TV, can exacerbate the symptoms. That's primarily just a physiological response to food. A normal person is going to eat sugar and probably be energized and then crash a little while later. It's just that people that especially people with hyperactivity, impulsivity, correlated ADHD are going to be more up than not people. You know what I'm saying? Okay, perfect, great.
The third one is ADHD is not a real disorder.
So this is only because of slang and media. So media portrayal, they tend to portray different disorders in extreme. So I can't remember, there was a show with this kid with ADHD and he was like 30, like throwing papers all over the place, and that's not real life, okay? I'm 30. That's a bad example because sometimes I do throw papers all over the place. But anyway, that's not, it's really damaging to people who do actually suffer with diagnosed ADHD. It's a recognized disorder by the American Psychiatric Association. I'm not saying it's damaging. We're not here to be like snowflake sad about it. It's not like somebody is like, oh, you just don't know how to control yourself in social settings, and then I cry. And that's not how it works. I'm just like, well, I'm sorry. That's what my brain says to not do. What my brain tells me that I shouldn't do is exactly what I'm going to do, because the other part of my brain that says, hey, don't do that, is like, don't listen to that side of your brain, right? That's how I picture it in my head. But it is recognized by the American Psychiatric Association, and there is no chance that it's going to go away anytime soon. I'm not just going to take it out and be like, well, it's not real anymore. It's not how it works. So do we have anything else? We do have other myths.
Another myth is people with ADHD can't focus.
So people with ADHD can't focus. This is, again, with the slang and with the acronym usage, that's where a lot of people, use it. Because, yeah, everybody has fuzzy days, and everyone's like, oh, I woke up 30 minutes too early, and now I can't focus, and I have ADHD. No. It's kind of true, but it's kind of not, because hyper-focusing is kind of like a superpower, especially in people with ADHD. So if you're legitimately interested in something, you can focus on that and nothing else matters. So that is the only thing that matters at that point in time, which is why a lot of people, especially with like cognitive behavioral therapy, is especially used for ADHD. And people will, try 14,000 different things, get it perfect, and then go on to the next thing, because once you've mastered something, you like don't care about it anymore, and it's just because of hyper focusing. So yeah, it's not like you can't do anything ever in your entire life.
So another one is only boys have ADHD.
Ooh, they're more likely to be incorrectly diagnosed before the age of 12 with ADHD, but that does not mean that women don't get ADHD or are not diagnosed with ADHD. A personal experience, doctors are more resilient to diagnose women with ADHD just because the studies were mostly based on the male brain, like they were back in the day, especially with autism as well. That was primarily males were used as the focus study, but they do, because it's a brain defect. It's not a gender defect. So yes, they are 2 times more likely to be diagnosed, but that doesn't mean that they're 2 times more likely to have it. And girls can't have it. Girls can do anything boys can do. Anyway. So ADHD is caused by brain differences. They are looking for more, factors that would play into why someone would be born with ADHD, but the heritability is substantial. It is very much genetics, whether someone's a carrier, 2 people are carriers, 1 person is a shower. I said that earlier too. I don't know what that means. The opposite of carrying, present, right? But genetics does play a very vital role in if future generations are going to be diagnosed. Because it is a neurodevelopmental disorder, it can be managed, but it's not, currently right now, there's no cure. Like, it's not like they can just increase brain volume and call it a day. Researchers are debating on if medication, therapy, or both together are best for managing. Typically, medications that are going to be used are going to be stimulants. Those work in 70 to 80% of people that are diagnosed with ADHD. Sorry, I'm choking. All that stimulants do is increase neurotransmitter levels, so you kind of, it all functions out. I'm not a brain doctor. Don't ask me. Anti-hypersensitives like clonidine and cognition-enhancing medication like guanfacine, those are pretty also common. Psychotherapy, which is just talk therapy, CBT, saying no, stick to a schedule, give yourself breaks, budget control, and using lists also are things from on the non-medication side that help. Don't don't do lists in excess. So I said I wasn't going to like tie this in because the series that I did 2 years ago is completely different, but I talked about how bad I was with lists. People think I'm joking or I'm a train wreck. Anyway, I should edit this, but I'm not going to. So I used to be very bad to the point where like, it would be like 5 a.m., wake up. 5:05, use the bathroom. Don't forget to brush your teeth while you're in there. 5:10, get dressed. To the minute my day was. And if there was like a period of time where it was like 3 p.m. to 6 p.m., just nothing was going on, something was going to go on in that time. I don't know what it was, but something was going to happen. So definitely seek help. Know that this is a recognized disorder by the American Psychiatric Association. And for some people, everyone, it presents differently. So some people might actually be suffering. So if you have that friend that's just a little too loud or a little too invasive, or is me, just, just be patient, be kind, listen to what they're going to say, because they're going to more likely than not, there's going to be a tangent. And you're going to have to follow every step because they already know what step they're on. Even though you're on step 1, they're on step 7. They've already filled in the gaps. So just always be patient, not only with your friends that are diagnosed, but with your friends that have no diagnosed disorders or a different disorder. And next, we are going to talk about body dysmorphic disorder. So if you have any questions about this, let me know. If you have anything that you want to add, let me know as well. And sorry that we're not editing this. Have a good day.